Cupping has some really good advantages to it and some really great applications. One of the great advantages of cupping is that it saves my hands. Another nice advantage of cupping is it lifts the tissues where most other body work techniques are going to be compression or traction. So it's nice to be able to get a lift, create a little bit of space between the tissue layers and opening up the circulation. So as I was describing before, if the muscle is tight and it constricts the capillary beds, then the circulation through the area is going to be diminished. Well, you can see how this would like lift and open and create space for blood flow, both arterial blood flow in and venous and lymphatic flow out, and both are really important. We don't want stagnation. You get stagnation when lymph and venous blood can't flow out, and we want good fresh blood perfusion, and hypo or lack of perfusion is what you get when the arterial blood is diminished, and either can create deconditioning of the tissue, deconditioning through lack of oxygen and glucose and fresh nutrients in arterial blood, and deconditioning through accumulation of metabolic waste products, lactic acid in particular in the muscle tissue, but really all cellular metabolic products will accumulate if lymph and blood are not able to flow through. So I'm using moving cups here, which is a really nice way to restore mobility between layers, get a little bit of space in there without tiring my hands out. Okay, and if we want to really focus on a particular area, we can set the cup there, get a nice amount of suction, and just leave it and let it set. And it's nice to warn your patients that this may leave a little bit of a bruise. Okay? Okay, so one of the things about cupping is, it leaves marks, which means if you're going to cup someone in an area that's visible, like around the neck, you should definitely let them know. And also there's just parts of the body that aren't the right size or shape for a cup to set. So when you do have the opportunity, like in the hips and the glutes and the low back, to use cupping, it's really nice. And cups are not expensive. They're really easy to find. These are from Amazon. I'll put a link to them in the video description so you can see. There's a lot of different kinds of cups out there. The traditional Chinese medicine technique uses flame to heat the inside of the cup so the air in there expands, and then you put the cup on the patient, and as the air cools, it creates a vacuum, and that's what gives you the suction. So one thing about that is that when you put the cup on, it's a little warm, which feels nice, but I don't love having open flame around patients and linens and towels, so I don't use that technique, although some would say, especially traditional Chinese medicine practitioners would say that is really the right way and the best way, but I'm doing it this way. And I like these purple cups. They're soft silicone, which makes them slide really nicely on the patient's body, and people generally tell me it feels pretty good when you slide the cups around. There's thicker cups and stiffer cups, but I like these nice soft ones. So just a pretty symmetrical placement here, right around S3-4, right where the piriformis, the glute max, and the sacrum all come together. It's an area of a lot of strain. And so here we are more now with my hands up around the section. I think this is more where you're feeling it. Okay. So around the gluteus medius and minimus insertion, and not quite to the tensor fasciae lata insertion, but almost there. So let's do a little bit of cupping along this section here as well in particular. So coming more into the symptomatic zone, you can see a little bit of purple here on his gluteal area. So again, a lift, just a pretty easy on my hands, lifting, rolling, and moving that tissue. I wouldn't think that one treatment is going to change the texture of the tissue. This is something that's been accumulating and happening for a long time. But probably make it less tender, give him more movement. I don't know how many sessions it would take or what exactly it would take to change the texture of these tissues in here. But as I palpated it, it does feel like it's sort of a combination of, yeah, there's a little bit of that. There's one right there. It just kind of feels like deconditioned tissue from lack of circulation, and I would attribute that to overuse. So you can see a loose suction on the cup a few times, no big deal. Just get it back on there and roll it over. So where do I feel the most? It's probably right there. Is that it for you? Yeah. Okay. So let's give it a big squeeze and hold. And let's do the same thing on the right side here. So Brian and I have been working together for, I don't know, at least 10 years. 15, 18? Was the first visit you saw me was probably when I was still downtown? Yes. Yeah, so I moved to this building in 2010. So more, probably at least 15 years, yeah. And I'm happy to say you've been really healthy and taking really good care of yourself, which is, you're doing a really good job. You are. Okay, right there. That's the most grainy. So let's, okay, good. Good. And we're just going to let that set for a few minutes, okay? Yeah. Cool. The nice thing you can do when you have static cupping is you can manipulate the cups a little bit. So I actually was just doing this last night to my knee. I did a lot of walking over the weekend. It's Monday. And my left knee was pretty sore. So I did a bunch of cupping on my left vastus medialis and vastus lateralis. So as you can see, the cup has got pretty good suction on there, and I can lift it, right? Kind of increase the suction and give it just a little grade 1 movement. So grade 1 is oscillation in neutral, and a grade 2 would be a slightly larger, okay, like this. And I'm really kind of feeling like, which direction does it feel the most restricted? And not all tissues will have equal mobility in every plane. We're not necessarily going for equality. We're just kind of getting a sense of what it is. And we definitely do want our soft tissue end feel to be nice and stretchy. Okay, so as I bring it kind of in this plane right here, that's where it feels the least not elastic and stretchy in the end feel. So I bring it straight to the end feel gently, that's grade 4, and then just give it a little bit of an oscillation right there. So this is like kind of analogous to a forceful adjustment of a joint, is to bring it to end feel and then move it through that end range just a little bit so we can get just a little more of a stretch. You can also use cups to create torsion and rotational movement in the tissues. All of that is really helpful. So again, we are creating space and mobility between layers of soft tissue in order to maintain and improve local microcirculation. That's the intention of what we're doing. Okay, so I was going to do the same thing here now on his right side. And I think, Brian, maybe you can get a sense of how much more easy this movement is. Yeah. On this side. There's really no plane of end feel that feels particularly stuck. Let's see. No, it feels pretty good. So a little lift, little twists. Feels good. Good. And we can get the cups off just by really gently sneaking a fingertip under the lip of the cup. So now this brings us to this left side of his pelvis and the misalignment that we are feeling here. So anterior, anterior, superior, and internal. So basically a misalignment kind of in that plane. Okay, so what we want to do is open and create a little more opportunity for this ilium to come back down, back and down, and a little bit more external. So kind of like that. So with my heel of my hand and my thumb, I'm giving it a little bit of external movement. And with my other hand, I'm lifting it and bringing it a little bit posterior. So I have done a lot of work over the years doing the side posture adjusting where the patient's getting twisted and there's going to be a pop. But over the years, I have found that to be less necessary and less comfortable for the patient and definitely harder on my body. So in the interest of my career longevity and not wanting to hurt myself, I just find different ways to do it. And I find that the cracking, some people, that's what they want. They don't feel like anything happened unless there's a big sound. But for the most part, people kind of prefer and appreciate a little bit more of a gentle approach. So that is what I am going for. You can feel that stuckness right there. So I was using the cup before to get that lift. Now I'm using my thumbs because I'm getting a little more precise. It's really right there. Is that tender? Yeah. Yep. Okay. Okay. So this is going to be a little bit of a challenge for me because the length of his legs versus the length of my arms, right? But we can do this. I'm going to get a bit of a wide stance, and I'm leaning on the table because I don't really want to use my back muscles to hold me up. But I'll make sure his toe is not jamming into the table. I'm going to just really gently traction through his leg. Okay, and as I'm pulling through his leg, you can see just the slightest movement in the lower back, and that's what we're going for. And remember, we want to bring this ilium down and give it a little bit of an external roll. So that is what I am doing with my hand. And as I'm working it into traction, I'm going to start working counter to that with my finger here, right up under the piriformis. Yeah, I can get my finger right up under there, lifting the sacrum. So we're getting a relative inferior movement of the ilium. So I'm lifting the sacrum and opening that lower SI joint. And that started to move a little better. And now just starting to create a little more of that EX, external rotation movement. So I know his hip is rotating internally while I do this, but in chiropractic, we call this external rotation of the ilium because our reference point is the PSIS and it's moving medial to lateral. So if you're a chiropractor or a chiro student out there, this is my way of working through an ASEX ilium with the patient prone, and it's very safe, comfortable, absolutely no risk to the discs. And if you were to call me tomorrow, which occasionally does happen, and say I'm really sore after that treatment, there would be no doubt in my mind that that particular treatment was not injurious. So I could say with confidence that his body is just adjusting and to take basic self-care measures. So that's it. That's how we do it. And so the question of why did his ilium do that? Why did he get stuck there? That I don't know. We can attribute it to just activities of daily living, especially like thinking about basketball. Believe it or not, in my 5'8" frame, I have played quite a bit. And, you know, he's going to grab that rebound. He's got his arms way up in the air. Hang on, let me get... It's asymmetrical. Totally asymmetrical. I'm just going to move this a little bit so you can see what the heck I'm talking about. Foot planted, feet planted, right? He comes down with the ball. I'm guessing because I've never grabbed a rebound in my life. and he's got it up over his head to keep it away from the short guys like me, right? And then you pivot, right? So your feet are planted and you pivot. And now there's, again, long legs, tremendous amount of physical force going through that SI joint, and just that pivot, and that can do it. It can cause that SI joint to just misalign just enough and in just the right way to create that stuckness. So that's my theory. I don't know. Maybe someday someone will come up with some way to monitor a patient's biomechanical habits moment to moment. But until that day, we just are making educated guesses. So that feels way better. Brian, thank you. I really appreciate you coming in today and doing this with me. Thank you for watching. This is Dr. Russ out.